Definitely too. Hi, I'm Bob Schrupp, physical therapist.
Brad Heneick, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, I want to talk briefly today, and this is mainly, I would say basically both of our opinions, but why with the total knee replacement, why some people wait too long to the point where they can't even have it.
Sure.
Okay, let's go over that. The first one is often just plain old fear.
Mhm.
They're just afraid of the surgery, and they're afraid of the outcomes. They're afraid of they're going to go through the surgery, and they maybe aren't going to have the knee's not going to be better. But I can tell you, Brad, anecdotally, I've worked with over 1,000 patients with knee replacements. So have you, I bet.
Yeah.
Vast majority are very happy with
Right.
it. Most of them have said, I wish I had done it sooner than later. Go online and look at some of the forums where there's discussion about this, and you ask anybody, should I have my knee done? And almost all of them will say, I wish I wouldn't have waited so long.
Right. Very true.
And these are some statistics. I've seen them on different sites. One of them was a government site, so I think this can be trusted. The government can be trusted, right, Brad?
I don't want to go there, Bob. Let's go somewhere.
But anyway, 9 out of 10 experienced dramatic relief. 95% were satisfied. 90% it lasted over 10 years.
Mhm.
80% lasted over 20 years.
Right.
80%, 8 out of 10 lasted over 20 years.
Yep.
But the number one reason I think a lot of people wait is because they're told to, aren't they? The doctor says, we want you to wait as long as possible.
Right. Especially people in their 50s.
Right,
because
50s,
if it
I'd
only
say
wa-
even 60s, they're
Yeah,
being told that.
sometimes.
40s, 50s, 60s, I would say.
And you might want to see a different doctor. If you think you're ready and your doctor says no, get a second opinion.
Or just say to the doctor, no, you know what, because this is what is happening. Let's say you're 55, Brad.
Okay.
How old are you?
52.
All right, let's say you're 52. 52 years old, and he's telling you to wait. You right now, you have a terrible quality of life. You can't do the things you want to do, right, Brad? You can't walk like you want to do. You can't maybe play golf. You can't bike. You can't do all these things. The things that you can do, which are really supposed to be somewhat the prime of your life. Your kids
Right.
are out of the house now. You're starting to, supposed to really start to enjoy yourself. So let's say you're able to wait till you're 57. 5 years of crappy life, and now it lasts 20 years, and you're 77 years old. Okay? Now you're going to have it redone anyway, right? Let's say if you had it done at 52 and you were 72 instead, either way, you're going to have it redone
Right.
in one time, right?
Right.
So why are you waiting?
And the odds of when you're 77 or even 70, you may have other medical issues that are going to prevent you from.
From having it done,
Right.
or either that you're going to have it done. But either way, you're going to have two done.
Right.
I just.
And right here is a spot that you got 5 years in the
Yeah.
prime of your life when
Exactly.
you got empty nest, the kids are gone, you want to have a little romance with your wife in your
Oh,
years.
good Lord.
Yeah, and sure enough, you miss that 5 years of fun,
Right.
and because when you just don't do those things when you're.
I mean, who's gonna, when you're in your 70s, now you can be very active and do a lot of things, but you're more likely gonna be a lot more active in your 50s.
There's a window
So,
of opportunity
yeah.
there. Is a big point.
So it's all about pain to me. I mean, if you got bone on bone and you don't have pain, I would keep going.
Right.
But if you're having pain and you're suffering, I think it's time to go. Because the worst thing that can happen, and this is what happened to my grandpa, he waited too long and then he was unable to have it. And once you're not able to have it, now your life is dramatically changed.
Sure.
And I had a patient yesterday, Brad, like this. She never had her knee replacement done. She's in her 70s right now, and she is immobile. I mean, basically she can walk maybe 30 feet. I mean, do you want to be that way in your 70s?
Right.
I mean, you want to be able to go.
On the other hand, I just discharged a patient, 55 years old, knee replacement in 4 weeks. She was completely rehabbed, minimal pain, outstanding outcome, and her prognosis is excellent. She's back to walking. The only thing keeping her from walking now is it's winter time and it's icy outside.
Sure.
So she's going to the school. She's getting back to walking. She has grandkids. She can now play
Great
with
quality
them.
of life.
You better believe it. And there's doctors, Dr. Lawrence Verocco, people come from him from all over the United States, and he'll do knees when other people won't at earlier ages.
Sure,
Just
I
a
think he
little-
understands that.
Yeah, he does.
What's the youngest you've had?
45 it was a male, 44 years old, he blew his knee out running a marathon. He didn't train for it. Some guys had a bet, they were all drinking and they got a bet, oh, do this marathon in a month. He didn't train at all before, and he did it, and he blew his knee out, and he had a replacement.
I had one that was 40 years old, both knees done at the same time,
Wow.
just kind of a genetic thing, it's
Mhm.
really bad, so. This is our opinion alone, but I would say sooner than later on knee replacement,
You
that's just
bet.
our opinion. You can send us, put your comments below, and please subscribe if you haven't already, because we're gonna give you lots of good videos on what to do to stay healthy and fit, well, 40, 50, 60, 70, 80, 90.
Yeah, you better believe it, and if we don't do that, at least you have fun watching us, hopefully, or make fun of
All
us.
right, talk to you later.